I'm here with Dr. Lisa Koche. We just recorded a podcast episode that's going to go live on the Keto Diet Podcast December 2nd, 2018. And in our conversation, we chatted a little bit about finding a doctor to support our ketogenic diet. We also chatted a little bit about maybe perhaps we're expecting too much from our doctors, how to become our own wellness advocate. So I thought this would be a great conversation for our Keto Unlimited members. If you want conversations like this that are exclusive to Keto Unlimited, you can go to theketounlimited.com to become a member. It's just a couple of dollars every month. So Dr. Lisa, thanks for joining.
Absolutely. Thanks for having me.
Of course, anytime. You have an open invitation anytime you want to come over.
Awesome.
So let's chat a little bit about our healthcare, because you've definitely done a great job at educating me on what to expect from a doctor. And I know that before I met you, I was quite discouraged in the health and wellness space, especially when it came to doctors. I've met with so many doctors that were sort of like, okay, well, goodbye then, so it's challenging when you don't understand bodies and you're going to somebody who you think should have all the answers and they don't. How do we navigate this as people who just want to have a healthy lifestyle?
So it is a tough one because, we don't go to medical school thinking that we want to come out pushing drugs and not having any answers. I was unusual because I was gifted many disease states at an early age. So I had to kind of navigate the medical field even before I went to medical school, being diagnosed with leukemia at age 15 and then having heart failure from chemo, Hashimoto's psoriasis, and many other problems that kind of have continued. So when I got to medical school, my favorite question was why? And, to my dismay, I would be rounding, or as a resident, I'd ask the attending, okay, we're treating this patient this way, but why? And really nobody had any answers. So it was surprising to me. And what I did was decide to choose a path that I thought would give me the broadest answers, which was internal medicine. And I think if we look back to step one, as far as where the disconnect in our current medical model is, it is in medical school, because you have the smartest and brightest coming in, excited, typically empathetic people. And then they're kind of discouraged to go away from like primary care and pediatrics and broader options because the pay isn't as good. It's not quite as sexy. It's, when you can be a specialist, you get to do all these cool things. So a lot of times people will go into specialties because there's answers, there's direct treatment, and they can get paid better. And so that's where the first, I think, disconnect is. And when you go into a broad thing like internal medicine, I was left kind of finding the answers myself. So then I was able to create my own type of residency. And this was back before a lot of the integrative training was available. And when I first dipped my toe into integrative medicine, I was like, this is what I'm looking for. So the good news for your listeners is, today there are huge societies like American Academy of Anti-Aging Medicine and the Institute of Functional Medicine, where people can look up on their websites. They can type in, I think, their zip code and find practitioners that, at the beginning should at least have a more broad base of knowledge in terms of some other answers besides just the traditional model, which tends to be medication, drug company kind of mediated.
And how do we go a step further by finding somebody who maybe doesn't understand keto fully, because we can find so much online and with different programs like Happy Keto Body and others, but just somebody that maybe respects the ketogenic diet and won't be like, what are you doing? Ketoacidosis, you're going to kill yourself. How do we find a doctor that will respect that and work side by side with us? Do you have any tips?
I think that's a great question. And I think inherently it's going to be a little bit tough only because the rapidity of the research coming out, how fast it's come out with, if you look at about 5 years, that to have a doctor, especially if it's more of like a primary care or an endocrinologist, to expect that practitioner to be really up on the research it's tough, because if they're not self-motivated like I was with, heart failure needing mitochondrial repair, so I found the ketogenic diet that way. A lot of them are not going to take the time or have the time to really understand it. So what I would do instead is say, your listeners should be the bringer of the information. I mean, if you have a doc that you're connected to, and that would be the goal, obviously, even if they have no idea what the ketogenic diet is, if they're scared of it, whatever the case may be, if they immediately say no and shut off with anything you bring up, you need a new doctor. Okay. Let's just be clear about that. But if you have someone open and connected, bring them a little bit of information. Maybe just tell them to check it out and let them make a decision, because the amount of people finding the ketogenic diet in spaces other than through their practitioner obviously far outweighs the doctors that can handle the questions that are coming with it.
Yeah, I think that's such a good tip, and it's very much like you have to grow with that healthcare practitioner. And I think a practitioner that's open to learning, even though they might not understand something, like myself, there are a lot of things I don't understand or I don't know yet. And when a client or somebody comes up to me and they're like, blah, 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 this happened, I'm like, really? And then that sparks me to want to learn more, and I'm learning more from my client. And that's such a gift. So I agree with you that just finding that good relationship is a base. What words of encouragement do you have? I'm sure you've come across this a couple of times where patients come to you and they've lost complete trust in the healthcare system. What do you do in that circumstance?
Okay, so absolutely. And I think it's a fine line between, where is the patient in all of that? So it's very easy to go right into kind of what I like to call victim mode, where everybody is sort of out to get you, but also there are true, terrible interactions with practitioners as well. So I think we kind of try to reset that, where can we just move forward from today? Whatever interaction that was bad in the past is that practitioner's issue, not yours. And are you ready to be, to let go of those experiences, step into your own personal power, and, work this as a team together? I think that's where the patient's perspective and attitude has to be for it to be able to work after bad experiences like that.
Yeah, amazing. Well, Dr. Lisa, thanks so much for coming on. I really appreciate it. I know that this conversation is one that a lot of people get stuck up on, and I've met so many people that just avoid going to the doctor because they're just sick of dealing with this. So I think you offered some really great tips. So thank you so much.
Oh, absolutely. Anytime.